Joe Sellers. I'm doing this for my leadership course. For my RN to BSN, this is the pain level scale in service. In PACU, we are always assessing pain, so it's really important that we know the different levels. We're gonna look at 4 different scales. We're not gonna look at the PIPs or the NIPS because we don't do neonates and we don't do babies here. We only do 1 year and above. And we don't do routine on those. Those are gonna be your call cases. So FACES, in order to qualify for FACES pain scale, it's gotta be a verbal patient over 3. You each have a copy of this. If they're smiling happy, it's gonna be 0 pain. And then you can see as it progresses, 1 to 4 is mild pain. If they're in this 2 or this 4, 6 is gonna be moderate pain. And then as they start frowning or crying, that is gonna be your severe pain. Most pain orders are gonna say you give this for moderate pain, this for mild pain, this for severe pain. That's why it's important to rate your patient's pain. For the numeric pain scale, it's really important that you use that pain scale for patients that have an idea of how numbers relate to each other. 4 or 5-year-old may know how to count these numbers, but they're not understanding how the numbers relate and why, if they say 5, it's a big deal if it's really a 7. So we're not gonna use those on pediatrics. 0 is no pain. 1 to 4 is mild. 5 to 6 is moderate pain. And then 7 to 10 is gonna be severe pain. Again, you can match those up with your doctor's orders that way. Numeric and FACES are considered verbal pain scales. Those are the ones that when your patients can talk or if the patient can point at the faces for you and say, I feel like that one. So, FLAC is faces, legs, activity, crying, and consolability. This scale has 5 different areas. We'll look at face first. If there's no particular expression or they're smiling, that's a 0. If they're occasionally grimacing or seem kind of withdrawn, that'll be a 1. And then frequent, constant quivering chin, clenched jaw, you can just see that they're really tense. That will be a 2. As you go through this scale and you add them up, your answers will total 0 to 10, somewhere in there. Legs. Normal position or relaxed is a 0. So uneasy, a little restless will be a 1. And then if they're kicking, legs drawn up, that's gonna be a 2. Activity. Are they lying quietly and they just seem to be resting? Then that's a 0. If they're squirming, shifting back and forth, tense, then that is gonna be a 1. And then if they're rigid or jerking, or if they're arching, I don't know if you've ever seen little kids will arch when they're in pain. They throw themselves back. Crying, obviously no crying is 0. Moaning or whimpering, maybe an occasional complaint, is 1. Crying steadily, sobbing, complaining, that's gonna be a 2. And consolability. If they're content, relaxed, that's a 0. 1 is gonna be reassured by occasional touching or hugging or you'll be okay. And then 3 is difficult to console or comfort. That's the kid that just doesn't stop hollering for mom. And so again, you're looking at 0 is no pain, 1 to 4 is mild, 5 to 6 is moderate, and 7 to 10 is gonna be severe.